Hello everyone, welcome to Dr. Sam's anatomy classes once again. Here I'm continuing my lecture series on Brainstem, and in this lecture I'll be teaching about the midbrain. Okay, so let's begin. So brainstem, once again, just have an idea here what is actually this brainstem is. You see here, this is the midbrain, then you have the pons, and then a medulla which continues the spinal cord, and dorsally it's covered this lower pons and upper medulla that has this cavity, dilated cavity, the fourth ventricle, which is roofed by the cerebellum. Now one thing is, look at this pink color thing. This is like the continuation right from the forebrain to the hindbrain, continuous, and that's called tegmentum. Clear? This is called tegmentum. But ventral to the tegmentum, in the midbrain you have this additional feature. This is called the Crus cerebri. This is the descending portion of the corticospinal tracts, corticonuclear tracts. Then in the pons, this dilatation, as I already told you, it's like a transverse band embracing the pons ventrally and on the two sides connecting to the two cerebellar hemispheres. So this bundle entry is the basilar portion of the pons, and it's mainly because of the pontocerebellar fibers, right? And it also of course has the vertically running down fibers. They are from the same continuation of Crus cerebri. These are the corticospinal as well as corticopontine fibers also, which even descend down to the upper medulla. Then in the medulla also you have this anterior bulging. This is the pyramids. This also is because of the corticospinal tracts, pyramidal tracts. So this much portion is a different portion, right? Here is Crus cerebri, here it's the basilar portion of the pons, and here it is the pyramids. But this portion, tegmentum, is continuous for the all ascending and descending fibers, tracts, as nearly the same pattern you have like entire length. Few nuclei which are continuous throughout, they run here. Now about the dorsal portion, you are seeing that the cavity of this midbrain is called the cerebral aqueduct, or aqueduct of Sylvius, named after a French scientist in 15th century. So this cerebral aqueduct, it communicates above to the third ventricle, down below in the lower pons it dilates from the fourth ventricle, the upper medulla as well. Then down below it continues as the central canal of the spinal cord at this point called the obex, and dorsally also it has this foramen of Megendai, laterally Lischkas foramen, where it communicates to the subarachnoid space as well. And dorsal portion is covered. This is a tent shaped roof called the roof of the fourth ventricle, covered by cerebellum. Now look here how it is actually placed within the cranial cavity. So within the cranial cavity, this is like the tentorial notch. You have this tentorium cerebelli here, right? Tentorium cerebelli is like this. So, and here it's the clivus, right? And here it is this foramen magnum, and this is the cavity of the posterior cranial fossa, right? And here the posterior clinoid process, and furthermore, well, I'm not going to into that, but here it is this straight sinus. This is all covered by a fold of dura mater, right? This is all covered by the fold of dura mater. This is called tentorium cerebelli. One thing. So what have you found? That this portion of the cranial cavity below the tentorium cerebelli is called infratentorial compartment, also called as posterior cranial fossa. This lodges the hindbrain mainly, and of course the lower portion of the midbrain as well. So in the hindbrain is also called rhombencephalon and includes two portions, mesencephalon and myelencephalon. Mesencephalon is pons plus cerebellum, while myelencephalon is medulla. So that is the hindbrain, the rhombencephalon. Then I'm now talking about mesencephalon. Now mesencephalon is the term given for the midbrain. Now because the prosencephalon, the forebrain, is resting covering the anterior, middle and post and the middle cranial fossa, extending above the supratentorial compartment. So that is all like the brain, the cerebral hemispheres. But this is the link, the brainstem. Its brainstem is also, this is the midbrain, and midbrain is the link between forebrain and hindbrain. So remember that midbrain is partly in the supratentorial compartment, partly in the infratentorial compartment. Got it? So that's how you must have got some idea about the midbrain and the brainstem. Right, now let's move to the next slide. Okay, here we are seeing is the ventral aspect of the brainstem. You have been told about this, right? This knowing pons, midbrain, and the dorsal portion of this midbrain has superior and inferior colliculus. They're paired colliculus, so they're called the corpora quadrigemina, right? And above to that, the dilatation here is the third ventricle, and onto the roof of this third ventricle you have this pineal gland. Okay, so now you're seeing is actually pineal gland is just dorsal to the upper portion of the midbrain, or you can say above to the superior colliculus in the median plane dorsally. Now in the ventral aspect, as I told you, tegmentum, remember in the previous slide I told you tegmentum was one thing which was straight continuous from in the entire three portions of the brainstem. But in the pons you have this anterior transverse, it has bands, it has striations running like this. This is how pons ventrally appears, and these are the transverse, actually these are the fibers of pontocerebellar tract which actually form the middle cerebral peduncle. They cross to the opposite side, right? From the pontine nuclei they reach the opposite cerebellar hemispheres through the middle cerebral peduncle, and here also you have the vertically running fibers also within this. And the vertically running fibers within this deep inside, these are the vertically running fibers. These fibers are of corticospinal tract, corticonuclear tracts, as well as embedded deep inside you also have nuclei. These are called the pontine nuclei, but the pontine nuclei, remember, these are more anteriorly, it's like more ventrally placed to the corticospinal tracts, so more ventrally placed. So all this thing which is placed in addition ventral to the tegmentum, this portion is called the basilar portion of the pons. We have already gone through. Now similarly in the medulla there was this pyramids, this bulging here was the pyramids. These were the pyramids. These were also bulging because of the corticospinal tract. In the upper portion of the medulla, and this down below you can see this majority of the fibers were decussating like this. So that's why you have this pyramidal decussation in the lower portion of the medulla. Now look, these fibers, the red color ones which I had drawn here, they're actually coming down from here, through the ventral portion of this cerebral peduncles. This is called the crus cerebri, and then they follow this course down like this is actually the course of this corticospinal fibers. So like in this ventral portion, when we look here at this medulla at the midbrain, so you find that it has this V-shaped ventrally placed cerebral peduncles, divergent laterally, superiorly and laterally they're divergent. Now because this is actually the mid junction of midbrain and hindbrain, right, this portion, so there leaves a space in between called interpeduncular fossa. Actually, let me tell you, there's you might have confused with the two names. This is Crus cerebri, but it is a part of cerebral peduncles. Like the brainstem literally means it's a stem. So a stem, it has to be connected to different branches. So when it diverges above, so those are the two peduncles through which the midbrain attaches to the two cerebral hemispheres. So these are the two cerebral peduncles. And the ventralmost portion of the cerebral peduncle here, what you're seeing, is called the crus cerebri. Similarly, the brainstem is connected to the cerebellum posteriorly with the help of three paired cerebellar peduncles, right? So if you dissect this out, the middle cerebellar peduncle, then down below you'll find that the two cerebellar hemispheres on the two sides, they're actually connected to the midbrain by the superior cerebellar peduncle, both the sides, which form the supromedial suprolateral boundary of the boundaries of the fourth ventricle. Similarly, down here from the medulla, you can see there this inferior cerebellar peduncles, right, on the lateral side of the medulla. They also are reaching above and they form the inferior cerebellar peduncles, right. The major fibers running through the inferior cerebellar peduncles are the climbing fibers, so olivocerebellar tract, right, they reach to the opposite side of the cerebellar hemispheres from the inferior olivary nucleus, which is present in the upper medulla. Okay, and here you can see that this portion here is the superior cerebellar peduncle. The superior cerebellar peduncle will be connected to the midbrain, right. So there are fibers through the superior cerebellar peduncle which communicate through the red nucleus, right. So one is like that, another one is like from the spinal cord, which ascends and then crosses to the opposite side, winds to this, and then which is the same, and that was ventral spinocerebellar tract, that was also passing through the superior cerebellar peduncles. Well, I'm just giving some names if you are getting it, grasping it right now, because slowly you come across new words. So because when I'll be teaching you about the cerebellum, that I'll be teaching in detail, but if you get familiar with these words earlier, it will be better. So then after these things, after these cerebellar, superior inferior cerebellar peduncles, you've got to know, then ventrally you place this thick band ventral to the pons, and that's called the middle cerebellar peduncles. Anyway, so what else you find here, that's between these two crus cerebri, this area is interpeduncular fossa, or actually you can even call it cerebral peduncles. So there you find is the posterior perforated substance here, then you finding down below is the mammillary bodies and the infundibulum of the pituitary stalk, and anterolate, or you can say anterolaterally in the two sides, it's the optic tract, right. That is how this midbrain is related. anterolaterally and anteriorly or ventrally to this interpeduncular fossa, you find is the optic chiasma that diverges in the form of two optic tracts. So slowly and slowly you are getting to know the relations of the midbrain, because the way I'm teaching you neuroanatomy is from caudal to rostral. We are ascending up in the nervous system. We thought about the spinal cord, then medulla, then pons, and now I'm teaching is the midbrain. And next I'll be teaching is cerebellum, and then we'll reach to the forebrain. So by this now you start understanding about the terminology related to the forebrain as well. Okay, so that's why I'm telling you to focus on these relations so that you get familiar with them when I'll be teaching you the other topics. Okay, so in this slide you are seeing this is what you're seeing is a cerebellar hemisphere with the sagittal section passing through the brainstem, median sagittal section, right? So the structures you're seeing here, you must this is the brainstem. The upper portion here, it is the midbrain, mesencephalon, right? And you can see above, it is continuous here. This area is the third ventricle, right? And you can see this is optic chiasma. This is the stalk of pituitary, the pituitary hanging down. There is mammillary bodies, and down below on the ventral side, this is the interpeduncular fossa. These are the two crest cerebri, the ventral portions, and this is the cerebral aqueduct. This is the cerebral aqueduct, right? Cerebral aqueduct. And dorsal to that you find is the tectum of the midbrain. So that includes the two superior and inferior colliculuus. And relation wise, if you see dorsal to the midbrain, what you find is the pituitary gland. You will find the largest commissural band of the white fibers, the corpus callosum, and this is the posterior portion called the genu, which is also in posterior superiorly related to the midbrain. And there will be vessels here just below the splenium of the corpus callosum. There you find there is the largest vein of the cerebrum, or the largest vein within the cranium. This is called the great cerebral vein of Galen. This is present here, and so this is also in posterior or dorsal relation to the midbrain. So these slides I'm trying to make up you an orientation about how are the structures related on either sides, on different sides of the midbrain. Okay. Now in this slide you are seeing the ventral portion of the midbrain. So here you find is the ventral relations. This, of course, I have told you the transverse striations. This is the pons with the basilar sulcus. This is the fifth nerve emerging with its motor roots. This is trigeminal. Now this is the junction of midbrain and pons, or you can say between midbrain and hindbrain, and these are the ventral portion of the cerebral peduncles called the Crus cerebri. So winding medially above to this pons, medially to this Crus cerebri, in this sulcus there, this called oculomotor sulcus, you find is oculomotor nerve is emerging, and lateral to this Crus cerebri, coming from dorsal side, you find that this emerges on the ventral side. These are the trochlear nerves. These are coming from the dorsal aspect of the midbrain. So you can see in the lateral relation to the midbrain, what you're seeing is the parahippocampal gyrus. So this is the parahippocampal gyrus, which is placed in lateral relation to the midbrain. And you also know that this parahippocampal gyrus, I have already taught you that this anteriormost portion of the parahippocampal gyrus on the inferior aspect is the olfactory area that includes uncus, area number 28 on the ventral, area number 34 on the dorsal side. Those are broad mains area. This is the parahippocampal gyrus, just adjacent, placed laterally to the crus cerebri. So caudal relation is pons, lateral relation is parahippocampal gyrus including uncus. Then or you can say rostrally, ventral and rostral relation may you have these, the optic chiasma anteriorly, and then the ventral laterally you have this is the optic tracts. Beyond to that, laterally is this, again a portion of this olfactory pathway, and this is the anterior perforated substance. And now you find this space is nearly a quadrangular space, like it has supralateral boundaries on the two sides and infralateral boundaries. Infralateral boundaries formed by the crus cerebri and supralateral by the optic tract. In this space is interpeduncular fossa, and it is filled with CSF, and that's called interpeduncular cistern. And the most important content lying here is the arterioles circulus vullis, that is like a communication anastomosis within the branches of vertebral, terminal branches of vertebral and terminal branches of internal carotid artery, that form a circle of arteries anastomosis here. Okay, so that you can say is a sort of pump house for the circulation of blood within the cranium, that circulus arteriosus vullis. Then other structures what you find is the mammillary bodies, and you find is tuber cinereum, and from which there is a stalk of pituitary called the infundibulum. So posteriorly you have the posterior perforated substance. These are the structures you find on the inferior aspect of the ventral aspect of the brainstem. Now this you seeing is the corpus callosum, which is like I told you the widest, broadest band of commissural fibers, and it has this posterior portion called splenium, and this why I have it like included in slides, so that you remember that just dorsal above to the midbrain, if you find there is this superior colliculuus, and above to that you find is pituitary. Above to that, I just told you, above to this is the sequence I'm telling you. You find is dorsally, this is tectum portion of the midbrain, superior colliculus, then superior colliculus, and you have pituitary. Then here you have this great cerebral vein of Galen, and then you have this splenium of corpus callosum. So these are the posterior relations of the midbrain. In the same continuation you are seeing here, this is again one of the structures which in posterior relation. This is the pituitary gland. Just to collect mind that what are the structures which you find on the dorsal or the posterior relation of the midbrain. So this is pituitary gland, and this is another view to see the dorsal or the posterior relations of the midbrain. So here you're seeing the cerebrum from above, where you have this a coronal section, and then a transverse section, and then an oblique section. There are three sections made here: coronal, transverse, and then an oblique section, to expose the structures in surrounding the midbrain here. So what you finding on the dorsal aspect, these two are the colliculus, superior and inferior colliculus, corpora, quadrigemina. And imagine that this portion here is at the upper portion, the clivus, and then ventrally to that you find that the interpeduncular fossa between the two crus cerebri, including the stalk of the pituitary, that was all resting over the diaphragma cellae between the two middle cranial fossa. So down below, if you pick this up, if you remove this, down below you will find here it is the diaphragma cellae, and onto which the interpeduncular fossa, the two crus cerebri, was resting along. So dorsally you find is these corpora, quadrigemina, and just dorsal above to the superior colliculus I have been mentioning, you find is the pituitary gland. And above to that, I told you, is the great cerebral vein, you will find of Galen. And of course, because the section has already been dissected out the upper portion, so there it was splenium of the corpus callosum. One in addition structure you can see here, that these are the thalamus. This is called the thalamus, right? So this is the thalamus, and it's not wrong to say that you can see that the posterior most portion of thalamus even reaches dorsal to the midbrain. Posterior most portion of thalamus even reaches posterior to the dorsal to the midbrain. And one more thing, why this made this oblique section, so to expose something down below. What can you say about this structure which is you are seeing here in between? They're like these are the two occipital lobes, right? With a space in between. This is like, of course, the medial longitudinal fissure. And there down below this, what is this structure? This structure, what you're seeing, you can see has transverse striations, and this structure actually is cerebellum, right? So the in between will be a partition called the tentorium cerebelli, which will separate the upper portion of cerebellum from the occipital lobes of the cerebral hemispheres. Okay. Now, relations with geniculate bodies. Now, there are actually geniculate bodies. There are also collection of gray matter in the CNS. Now look here, these are actually part of the special sensory tracts. One is for, there are two geniculate bodies. One is lateral geniculate body, this one, these sides, and medial one is the medial geniculate body. So both these geniculate bodies are a part of basal nuclei, and they part of the sensory tracts. So LGB, or the lateral geniculate body, is a part of visual pathway, while this medial geniculate body is a part of auditory pathway, right? Well, to understand this section, you can see that this is the cut section of a transverse cut section of midbrain, which has the two colliculus here, the superior colliculus, these are the inferior colliculus, and this is the tectum. This portion is the central canal, the aqueduct. This is tegmentum, this is substantia nigra, this is the crus cerebri. So you have this orientation, that means something here, it's the ventral portion, here it's the dorsal portion, these are the lateral sides. Okay, then and this also I had already told you, this is the interpeduncular fossa with the posterior perforated substance, mammillary bodies, tubercinarium, infundibulum of the pituitary, everything has been discussed. Now look here, geniculate bodies are placed lateral to the midbrain, remember this. And laterally, actually, I had also told you there was this the temporal lobes with their parahippocampal gyrus surrounding, and another structures which you need to know in lateral relation to the midbrain are the two colliculus. Now talking about this lateral LGB, lateral geniculate bodies, you know that these are optic nerves, and there the fibers in on one side, this is the optic tract. So the temporal fibers, actually the fibers from the nasal retina, nasal half of the retina, they decussate and reach to the opposite side, while the temporal portion of the retina, the fibers do not cross and they continue the same side. So there is how these fibers run in the optic tract, with the macular fibers in center and the fibers from the lower half of the retina, lower portion of the retina, they run above, while the fibers from the upper portion of the retina, upper half of the retina, they run in the lower portion of the optic tract. So as to remember, image that is formed in the retina is an inverted image, and ultimately your body perceives it as a vertical image. So the fibers running here have inverted continuation. The representation of the fibers is that the fibers from the lower retina run above, macular fibers in between, and the fibers from the upper retina, they run below. Now what happens when they reach laterally? It divides into two roots. This optic tract divides into lateral and a medial root. So medial contribute, actually the thicker root is the lateral root. The medial root is the which continues a supraoptic commissure, that participates in the supraoptic commissure, while the lateral tract, which has more abundance of fiber, they reach to the lateral geniculate body, and from the lateral geniculate body, most of the fibers, they still continue down behind as optic radiation and reach to the primary optic stria, right? Visual stria, A number 17. Now important is that some fibers from LGB, you can see, they pass through this band, and this band is called the brachium. This is the superior brachium. So through the superior brachium, these fibers reach to the superior colliculuus. Got it? And through the superior colliculuus, the purpose here is from visual sensations from the LGB through the superior colliculuus to reach the LGB for the superior colliculuus, is to convey to another tract inside, or the nucleus inside the pretextal nucleus. And that is, I'll tell you further, that's about the consensual eye reflex as well as for visual protective reflexes. This pulvinar is also another portion as a part of visual pathway, which we'll discuss later on. So one thing, have you realized that from LGB, the fibers are actually reaching to the midbrain, right? So the pattern is like here the fibers are running from this way. The fibers are running this way from LGB towards the superior colliculuus. Now about the auditory pathway, and from the auditory pathway, how is this MGB related? Optic pathway is like from the auditory pathway, I'm telling, is from the organ of Corti. Sensations are brought through auditory nerve to the cochlear nucleus, ventral and dorsal cochlear nucleus situated in the lower pons, above and lateral to the inferior cerebellar peduncles. There they relay. Then what happens? Then after being relayed, they were the bipolar neurons. They have relayed there. Now the second order neurons from this inferior library nucleus, from the cochlear nucleus, they will actually decussate and move to the opposite side towards this superior olivary nucleus, and they will pass to the trapezoid body, to the trapezoid nuclei and all. So ultimately it's the second order neurons which relay in the superior olivary nucleus. Now from the superior olivary nucleus, the third order neurons will ascend up into the pons in the form of lateral lemniscus. And don't forget, in the lateral lemniscus there are also some nuclei, right, which will have, like I'll tell you, the communication to the medial longitudinal bundle. That's a different thing. So through this lateral lemniscus, the fibers will ascend up and relay here in the medial geniculate body. So it is the third order auditory neurons that relay here in the medial geniculate body, right? So from the medial geniculate body, the fibers will, you can see here, medial geniculate body, the fibers will now ascend up into the from here superior ivory nucleus, then medial geniculate body. So through this inferior brachium, you can see this is inferior brachium. Through this inferior brachium they reach into the inferior colliculus, and from inferior colliculus they will ascend further up into the thalamus. So means what? You have this medial geniculate bodies in the auditory pathway, have a role in auditory pathway, and this actually, by till now, the third order neurons, when they have reached here, what have you collected is that not only the auditory sound, impulses of sound, but also by this time you have also been able to localize the sound. So the auditory sensations, by the time they have reached to the MGB, you are able to localize the direction of sound as well. Okay, so this was all just, I keep on repeating in between, so that people who are collecting entire information of nervous system, if you're beginners, you're studying it, so it's, you can recollect what I'm telling is, if you've gone through these topics before, or you might go read it further, this will help you. So keep on, revising the topics in between. Okay, so now let's move to the next. Okay, now relations of the veins surrounding the midbrain. So important veins surrounding the midbrain, and in fact they are also providing the venous drainage to the midbrain. You can see it's this pons medulla, and this portion here is the midbrain. These you can see are the crus cerebri, and here are the corpora quadrigemina, the cerebellum, the fourth ventricle. There you see, this is how actually it is resting. This is the basic sphenoid, the body of sphenoid, with this sphenoidal air sinus. This is stella turcica lodging the pituitary. This is the foramen magnum, and here you finding is the occipital bone. This is tentorium cerebelli with the straight sinus. This is superior sagittal. This is the this is the straight sinus, and this is the inferior sagittal sinus. No, this is the occipital sinus, and this is the inferior sagittal sinus. Anyways, look here now. Try to correlate the structures here. This you seeing is the thalamus, and this I already told you is about the corpus callosum, and that's the splenium of the corpus callosum. So in this diagram, let's focus on the veins. Here you seeing is so here you seeing is this, this is the anterior cerebellar vein, right? And then you are seeing is the deep middle cerebral veins, right? And they continue now. Here you can see this is what I'm talking is the basal vein of Rosenthal. Okay, so basilar vein of Rosenthal is related laterally to the midbrain, and it is one of the vein which drains the midbrain. Now this basal vein of Rosenthal, when it reaches, dorsal to the midbrain, it receives two paired veins. It is joined by two paired veins. You can see here, these are the internal cerebral veins. When all of them they join here, behind this, as I already told you, behind or dorsal to the corpora quadrigemina, just below the splenium of corpus callosum, they form the one of the largest, the largest vein of this cranium, and that's the great cerebral vein of Galen. The great cerebral vein of Galen. So these are important structures. Great cerebral vein of Galen as well as the basal vein of Rosenthal. You should learn these names and the relations. So basilar vein is laterally related to the midbrain, while the great cerebral vein is dorsally related to the midbrain. And structures one by one: splenium, great cerebral vein, pituitary, and the posterior most portion of thalamus. All these are dorsally related to the midbrain. Okay. Now we'll talk about the relations of midbrain to the posterior cerebral artery. Here you seeing is the ventral portion of the brain, and you have been taught about the blood supply of medulla. Here you seeing the two vertebral arteries. They giving the medial branches which join to form a single unpaired artery. This is the anterior spinal artery running in the anterior sulcus of the medulla, providing blood supply to the middle 1/3 of the medulla. Then the two vertebrals join to form the basilar artery. Basilar is an unpaired artery. It runs in the basilar groove of the pons. And don't forget that the largest branch of the vertebral artery is this. And it has a tortuous course. This is the posterior inferior cerebellar artery. Right? So don't forget that this artery supplies the lateral 2/3 of the medulla as well, the inferior portion of the cerebellum. Then the two vertebral arteries, they joining to form the basilar artery. Now the basilar artery gives different branches. One of the branches that it gives at the lower portion of the pons, this is anterior inferior cerebellar artery. So anterior inferior cerebellar artery will supply, of course, the cerebellum, but it will also supply part of the lateral portion of the pons also. Then it gives, you can see these are the perpendicular branches running out from this basilar artery. These are called the pontine branches. Few of them dip down paramedially, few of them run radially to form the short and long circumferential branches from the basilar artery to supply the maximum portion of the blood supply to the pons. Then above, when it reaches at the upper limit of the pons, it gives its branch called the superior cerebellar artery, or anterior superior also you can say, anterior superior cerebellar arteries. These superior cerebellar arteries will also supply blood to the lateral portion of the pons, as well as dorsally. When it will wind around the mid-crus cerebri, dorsally they will also provide blood to the corpora quadrigemina on the dorsal side, to the colliculuus, superior and inferior colliculuus. Finally, this basilar artery, and don't forget there's a labyrinthine branches also from the basilar artery for the to run within the internal acoustic meatus along with the facial and the eighth nerve. So, and labyrinthine artery is an end artery. remember that. So the terminal branches of the basilar artery are the green color ones, because that is in the question which we are talking about, and so they have colored it is in green. So the green ones are the posterior cerebral artery. They are the arteries which we are discussing about. So it's the terminal branches of the basilar artery at the junction of midbrain and pons. So these are the divergent branches. So they diverge laterally and wind around the cerebral peduncles of the crus cerebri, and they wind around the two cerebral peduncles. Ultimately they run on the inferior surface of the cerebral hemispheres okay, to provide the blood supply to the inferior surface of the cerebrum. But important is that this artery, the two arteries, posterior and superior cerebellar, posterior cerebral and superior cerebellar artery, in between they provide, space here, right? In between they provide space here for the oculomotor nerve to emerge out. You can see here, right? That emerges between the two arteries. Another thing is you are finding here is the internal carotid arteries, and the terminal branch of the internal carotid is anterior cerebral and the middle cerebral. Middle cerebral, they have, you can see this is a cut section here. Why is this a cut section here? Because they have tried to expose the lateral sulcus. Now this, you can see in between here there is a sulcus, a deep sulcus. Now this sulcus is actually not a true sulcus, it is a secondary sulcus formed because of the lessening of the sphenoid, because it's a mechanical pressure because of growth of the skull because growth of the brain, and because of that lessening the sphenoid, this depression goes inside and that forms the lateral sulcus. So this middle cerebral artery runs within the stem of lateral sulcus. You can see here, this is a middle cerebral artery. Okay. Then the other branches from the internal carotid, you can see is this one, the posterior communicating arteries which join the posterior cerebral artery. Posterior communicating is a branch of internal carotid which joins the posterior cerebral artery to complete the circle of Willis, while the two anterior cerebral arteries will also join to the anterior communicating artery to form an entire complete circle. The question is important is that oculomotor nerve relation with the posterior communicating. So oculomotor nerve, remember, the nerve runs in lateral relation to the posterior communicating artery. Anyway, so having some idea actually the structures here, I believe you are getting to know slowly the relations here. So this artery, posterior cerebral artery, it laterally also gives the posterior choroidal branches. Choroidal branches, they are deep branching down below, it goes to supply the choroid plexus. Similarly, few of the branches from one of the branches from the internal carotid artery is called the anterior choroidal artery. Anterior choroidal artery, posterior communicating artery, posterior cerebral artery, superior cerebellar artery, these are all the blood supply to the midbrain. Okay. Then but of course the major blood supply to the midbrain will be from the posterior cerebral arteries, because it's winding around like the two sides of the cerebral peduncle, giving down its cortical deep branches, perforating branches to supply the maximum area portion of the midbrain. So what have you seen the relation of posterior cerebral artery is? Like it is related ventrolaterally. The two arteries wind ventrally and laterally along the crus cerebri. Okay. That is the relation of posterior cerebral artery to the midbrain, and it is the major blood supply to the midbrain. Now what is the relation with optic chiasma and optic tract? This also you see is the ventral aspect. Here you seeing is the cut section or transverse section of the midbrain. This is dorsal portion, the colliculuus, then aqueduct, then this is substantia nigra, these are the crus cerebri, interpeduncular fossa. So what you're seeing in lateral relation, this lateral relation, this is the parahippocampal gyrus, which is in lateral relation to the midbrain. Okay, and anterior, this is interpeduncular fossa here. So what you're seeing is just anterior relation. Anteriorly here it is the optic chiasma, and anterolaterally it is the optic tract. So this is how the two optic tracts. Actually, this is a transverse section. You're not able to see the direction of the crus cerebri. It is actually going like this. The crus cerebri, it's actually going like this, right? Yeah. So at least now you should have idea that this optic tract also winds the optic crus cerebri on the two sides, anterior ventrolaterally. Okay, so that is how you can remember the relation, that all these is in relation to how it is in relation with the midbrain. Okay, now in this diagram we will again see in a different view the relation of veins, the main veins of the intracranial veins with that of the midbrain. So this is a cut section of the midbrain. The colliculus, central aqueduct, that substantia nigra, you can appreciate this portion is called the crus cerebri, interpeduncular fossa, right? Okay, this portion dorsal to the central aqueduct is called tectum. Okay, now look here, this is all the structures in the interpeduncular fossa, optic tract, everything. This is the parahippocampal gyrus. You also got to know about this. Now look here, what I was telling is about the basilar veins. So the anterior cerebral vein and the deep middle cerebellar veins, they join together to form this basilar vein. So you can see the entire course of basilar vein is just surrounding the lateral sides of the cerebral peduncles of the two sides. Got it? So this is very important, a good slide I would say, so as to understand the relation here. You can see this is how the relation of the how this basal vein of Rosenthal is related to the midbrain. On the two sides, it entirely, from the ventral to the dorsal side, covering from the lateral side, that's how this basilar vein of Rosenthal related to the midbrain. And can you guess which other structures follows the same course? Anybody? Yes, it is trochlear nerve. Very good. So trochlear nerve also emerges on the dorsum of the midbrain, and it winds and decussates and winds to the opposite side. Just the same course you can see is that of the basilar vein. So basilar vein and the trochlear nerve, they're nearly having the same course. When it reaches here, it crosses here this cerebral peduncle, superior cerebral peduncle, as well as the crus cerebri. Between the crus cerebri, it emerges down here, lateral to the crus cerebri on the ventral aspect, that's trochlear nerve. And same will be the course here, you can see, is of the basilar vein of Rosenthal. Now the dorsal relation, the posterior relation of the midbrain, I have been telling you before also that these two basal veins, when they join, they also receive two internal cerebral veins, and together the confluence, you develop this vein. This, although is a short vein, but it's set the largest vein of the cerebellum. They have zoomed this out here. Can you see? They have zoomed this image here. So that means this green color portion is the structure we are talking about, and that is the great cerebral vein of Galen. It's a short vein because soon it continues as the straight sinus. Straight sinus is onto the dorsal aspect of the tentorium cerebelli, or you can say it's the posterior inferior attachment of the fox cerebri to the tentorium cerebelli that form the straight sinus. So the great cerebral vein of Galen is the small but the largest vein of the cerebrum, and it is dorsally related to the midbrain. And above to that, what will be there? The splenium of corpus callosum. Got it? As well as pituitary gland, they're all dorsally related. So I believe you got to know about this. Okay, next is the relation of midbrain to the trochlear nerve. You all know I've been I just taught you enough in detail about all the cranial nerves. Trochlear nerve having this peculiar feature of arising from the dorsum. Only cranial nerve which arises from the dorsum of the brainstem is trochlear nerve. Okay, now look here. This is the cavity of the fourth ventricle. Got it? And these two, the elevations formed on the superolateral margins of the fourth ventricle, they are actually a part of the superior cerebellar peduncle, and that called superior medullary velum. The superior medullary velum in between here has this portion called frenulum veli. So, and these are the inferior genigulate tubercles, right? So these are inferior I should select this one. So you are seeing here, this is the inferior genigulate or inferior colliculuus. So at the level of inferior colliculuus, dorsally, the two nerves, after emerging out of the trochlear nerve nucleus, they decussate within the superior medullary velum. Got it? And when they'll decussate within the superior medullary velum, they'll decussate and reach and emerge on the either side of this structure called the frenulum veli. In between, this is a frenulum veli. So it emerges on either sides, and then it will wind on the two sides of the cerebral peduncles. Here you can see this very well. This is how you can see it's a cut section at the inferior colliculus level pe. Then you are finding it's this crus. This is crus cerebri, substantia nigra, tegmentum, this is tectum. There you find is the gray matter surrounding the cerebral aqueduct. So there you find is the trochlear nerve nucleus. Trochlear nerve nucleus is this, and of course this mesencephalic nucleus of trigeminal also in the vicinity laterally in the gray matter. So the nerve it emerges, and don't forget that medial longitudinal bundle is just ventrally related to this fourth nerve nucleus. And very important structure is this. Very important structure. This also is a hallmark feature for identifying the section at the level of inferior colliculus. Very important structure. This actually is the decussation of the fibers of superior cerebellar peduncles, which is a feature of the section of midbrain at the level of inferior colliculus. Anyway, so now you see is the trochlear nerve that it emerges, it winds around the central gray matter surrounding central aqueduct, then it winds, and there this this portion here is called the superior medullary velum. This is called superior medullary velum. So the two nerves on the two sides, you can say that this nerve that it is emerging out is the trochlear nerve of the left side, and this from here it will be the trochlear nerve of the right side. This is how the two nerves emerge and they decussate within this superior medullary vellum. And what structure that covers this decussation on the dorsal side, this is called the frenulum vellae. This is frenulum vellae. Got it now? That's how the two nerves decussate. So it's an example of where the lower motor neurons will innervate the contralateral muscles. A very rare example, because 99% cases, the lower motor neurons from the nucleus, they emerge and they supply, innervate the muscles of the ipsilateral side. This is one of the few examples where the lower motor neurons innervate the contralateral muscles. And one other example I have told you, if you were going through my previous lectures, I just give you a hint. Go through the oculomotor now. There was this one nucleus which innervates the contralateral muscles of the eyeball, and that was within this oculomotor nuclear complex, and that was nucleus nerve 2, superior rectus. So nerve to superior rectus also supplies the contralateral suprarectus muscle. So two muscles now, remember, superior oblique, superior rectus. Both of them are innervated by the nerves of the opposite side. Clear? Okay. So that's how, and that is the same pattern which will be followed by the basilar vein of Rosenthal. So both of them, both two structures, they wind around the lateral aspect of the cerebral peduncles and they emerge on the ventral side. Got it? Okay.